A vegetable sitting in your refrigerator right now could be silently raising your stroke risk, and your doctor may never have warned you about it. That changes today. Before anyone panics, fresh vegetables remain one of the most powerful protectors against stroke that exists. 20 cohort studies involving over 760,000 participants showed that people who eat the most vegetables carry a 21% lower stroke risk, and every 200 grams added to your daily diet drops that risk by another 11%. Vegetables are good. Nobody disputes that. No major health organization, not the American Heart Association, not the World Health Organization, not the Mayo Clinic, not the Cleveland Clinic, warns against eating them. Here's what they don't always spell out. Certain preparations of vegetables, certain interactions with medications, and certain health conditions can flip these protective foods into genuine risk factors. And this is where it matters most for anyone over 60, because the risks we're covering today hit seniors harder than any other group. We're going to break down 3 evidence-based pathways through which certain vegetables can elevate your stroke risk. You'll learn the specific vegetables involved, the exact mechanisms at play, the statistics from peer-reviewed research, and what you can actually do about all of it. The biggest culprit comes first. Part 1. The sodium bomb in your pantry. The strongest scientific evidence linking vegetables to increased stroke risk doesn't involve fresh vegetables at all. Pickled vegetables, fermented vegetables, preserved vegetables. That's where the danger lives. One number should grab your attention here. A landmark meta-analysis published in the British Medical Journal looked at 13 studies with 175 participants. And researchers from the University of Naples and the University of Warwick's WHO Collaborating Center discovered that high salt intake carries a 23% greater risk of stroke. What makes this truly alarming is the dose-response relationship they found. Stroke rates climb 6% for every 3 grams of additional salt consumed daily. That amounts to roughly half a teaspoon. Most people will say they don't add that much salt to their food, and they might be right. What they don't realize is where pickled vegetables become the hidden villain. 1 cup of undrained sauerkraut packs 1,560 milligrams of sodium. The American Heart Association recommends no more than 1,500 milligrams per day for optimal heart health, which means a single cup of sauerkraut, something many people consider a healthy addition to their meal, contains 104% of your entire daily sodium limit. Draining that sauerkraut still leaves you with 939 milligrams, 63% of your daily limit from one side dish. Dill pickles run about 809 milligrams of sodium per 100 grams. And a single kosher dill pickle spear contains between 260 and 320 milligrams. Traditional Asian preserved vegetables push the numbers even higher. Chinese preserved vegetables like shikai and meikai can reach up to 10% salt concentration. None of this is theoretical. April 2023 brought results from the China Kadoorie Biobank study, one of the largest of its kind, published in BMC Medicine. Researchers at Zhejiang University School of Medicine tracked 440,415 participants for approximately 10 years, and the findings were stark. Preserved vegetable consumption showed a dose-dependent relationship to higher blood pressure and hemorrhagic stroke mortality. More preserved vegetables meant higher risk, plain and simple. The mechanism goes beyond sodium alone. Preservation creates N-nitroso compounds, chemicals that form during fermentation and carry their own health consequences. The Northern Manhattan study, published in Circulation in 2012, pinpointed sodium intake of 4.0 milligrams or more per day as specifically tied to stroke risk, calculating a 17% relative increase in stroke hazard for every 500 milligram daily increment in sodium intake. That same study found only 12% of participants meeting the American Heart Association's recommended limit of 1,500 milligrams or less per day. Average American intake sits at 3,400 milligrams daily. Eating preserved vegetables regularly on top of an already sodium-heavy diet compounds the problem. None of this means sauerkraut or pickles are forever off the table. What it means is you need strategy. Rinsing preserved vegetables cuts their sodium content by 20 to 30%. Choosing no salt added or low sodium varieties slashes sodium by 50 to 75%. Treating pickled vegetables as small condiments rather than side dishes limits exposure. And balancing intake with potassium-rich foods helps your body process whatever sodium you do consume. Fresh cabbage instead of sauerkraut, fresh cucumbers instead of pickles. gives you all the nutritional benefits with none of the sodium risk. Part 2. The leafy green paradox. An estimated 2 to 3 million Americans face this next risk directly, and millions more don't even realize they're exposed. Anyone taking warfarin, also known by brand names like Coumadin, needs to hear this section carefully. It could save a life. Warfarin is a blood thinner prescribed mainly to prevent strokes in people with atrial fibrillation, an irregular heartbeat that causes blood to pool and potentially form clots. Atrial fibrillation multiplies stroke risk by 5 and causes approximately 80,000 strokes in the United States every year. Warfarin works by inhibiting an enzyme called vitamin K epoxide reductase, which prevents your body from making certain clotting factors that depend on vitamin K. Thinner blood results, blood less likely to form dangerous clots. Here's the catch. Vitamin K fills leafy green vegetables. A sudden increase in vitamin K intake bypasses warfarin's block through a different pathway. Your body starts producing those clotting factors again. Your blood thickens and stroke risk climbs. The numbers on this are striking. A 2003 study in the New England Journal of Medicine followed 13,559 patients with atrial fibrillation, measuring something called INR, which stands for International Normalized Ratio and indicates how well warfarin is working. Therapeutic range runs between 2.0 and 3.0. Patients with an INR below 2.0 carried 1.9 times higher odds of severe stroke and 3.4 times higher 30-day mortality risk. Put differently, at therapeutic INR levels, only 5% of patients died or experienced severe disability, but at an INR below 2.0, that number jumped to 15%. Research published in the American Heart Association's journal, Stroke delivered even more dramatic findings. An INR below 1.5 meant 4.13 times higher stroke odds compared to therapeutic range. Among stroke patients admitted to hospitals, 43.5% were significantly under anticoagulated versus only 20.9% of non-stroke patients. Which vegetables carry the most vitamin K, according to the NIH Office of Dietary Supplements? A half cup of cooked collard greens holds 530 micrograms. That's 442% of your daily value. Cooked spinach runs about 525 micrograms per half cup. Turnip greens hit 426 micrograms, and a cup of cooked kale exceeds 1,100 micrograms, more than 900% of daily value. Even a cup of raw spinach delivers 145 micrograms, and green leaf lettuce contains 126 micrograms per 100 grams. Utah State University research indicates that vitamin K intakes greater than 500 micrograms can reverse anticoagulation therapy, with approximately a 0.2 INR unit decrease for every 100 microgram increase in vitamin K over 4 days. The solution, and this matters, is not abandoning leafy greens entirely. Dr. Leslie Cho, a cardiologist at the Cleveland Clinic, puts it this way: vitamin K is an essential part of the chemical process for forming blood clots in your body. Don't cut out vitamin K completely. Julia Zumpano, a registered dietitian at Cleveland Clinic, offers this guidance. Vitamin K foods can be included in your diet on a regular basis, as long as you are mindful of the portion and keep the overall intake of vitamin K-rich foods consistent. Consistent is the operative word. A 2016 systematic review found conflicting evidence on restricting vitamin K. Some studies actually showed that consistent higher vitamin K intake, over 300 micrograms per day, decreased the risk of subtherapeutic INR by 20%. Intake below 100 micrograms per day increased that risk by 33%. The researchers reached this conclusion: restriction of dietary vitamin K intake does not seem to be a valid strategy to improve anticoagulation quality. What matters isn't how much vitamin K you eat, it's how steady you keep it. A big spinach salad every day lets your doctor adjust your warfarin dose to match. 2 weeks of no leafy greens followed by 3 salads in 1 day sends your INR plummeting and your stroke risk spiking. The American Heart Association recommends eating relatively similar amounts of vitamin K each week, not eliminating it. Cleveland Clinic guidance suggests planning no more than half a cup of high vitamin K foods per day, or eating more as long as you keep consumption consistent. Another option worth mentioning: direct oral anticoagulants, medications like apixaban or rivaroxaban, don't interact with vitamin K patients unable to maintain dietary consistency, may find these newer medications a better fit. That conversation belongs with your doctor. Why is this hit seniors harder than younger people? First, atrial fibrillation prevalence rises sharply with age, expected to more than double from 5.6 million patients to over 12 million in coming decades, with older adults making up the overwhelming majority. Second, elderly patients show exaggerated response to warfarin due to reduced drug clearance. Age over 75 adds 2 points to the stroke risk assessment score doctors use. Third, maintaining consistent INR grows harder with age. Studies show label INR rates reaching up to 94% in elderly inpatient populations. Leafy greens aren't bad for you. How you eat them when you're on warfarin matters enormously. Part 3. The oxalate question. The third pathway carries more nuance, and the evidence here isn't as strong as the first two. It primarily affects people with specific health conditions. Anyone with kidney disease or a history of kidney stones needs this information. The Tehran lipid and glucose study tracked 2,966 adults for 10.6 years and found that dietary oxalate intake of 220 milligrams or more per day increased incident cardiovascular disease by 47%. That risk jumped to 142% higher, nearly 2.5 times the baseline, in people with low calcium intake, specifically below 981 milligrams per day. Oxalates are compounds concentrated in certain vegetables. Spinach tops the list with 329 to 2,350 milligrams per 100 grams depending on preparation. Rhubarb contains about 1,764 milligrams per 100 grams. Swiss chard and beets also rank high, with beets carrying about 152 milligrams per cup. The mechanism involves vascular calcification, calcium oxalate crystals depositing in blood vessel walls, along with systemic inflammation through a pathway called NELP3 and endothelial dysfunction, meaning the inner lining of your blood vessels stops working properly. A caveat belongs here. This evidence comes primarily from a single major cohort study, and the Mayo Clinic proceedings in 2024 described the oxalate cardiovascular disease pathway as neglected and requiring more research. The strongest associations appear in people with kidney disease who cannot efficiently excrete oxalate. The German 4D study, published in the Journal of the American Society of Nephrology in 2021, found that the highest quartile of plasma oxalate carried 40% increased cardiovascular events in diabetic dialysis patients. Who needs to pay closest attention to this? People with chronic kidney disease, people with kidney stone history, people with low calcium intake, people who've undergone gastric bypass surgery, and people taking high-dose vitamin C, which metabolizes through oxalate in the body. Anyone in those groups should consider discussing high oxalate vegetables like spinach, Swiss chard, beets, and rhubarb with their doctor. Adequate calcium intake, at least 981 milligrams per day, helps bind dietary oxalate in your gut before absorption can occur. For everyone else, the oxalate concern carries far less weight. Cardiovascular benefits from eating vegetables like spinach almost certainly outweigh any oxalate risk for people with healthy kidneys. Part 4. The nitrate myth. You may have heard that nitrates in vegetables are dangerous. That claim deserves debunking. Research published in the European Journal of Epidemiology in 2021 found that people consuming 60 milligrams or more of nitrates daily from vegetables, equivalent to about 1 cup of leafy greens, showed a 17% lower stroke risk. The mechanism works in your favor. Your body converts vegetable nitrates into nitric oxide, which regulates cerebral blood flow, inhibits platelet activation, helps relax arteries, and brings down blood pressure. Registered dietitian nutritionist Sonia Angelone explains it this way. Green leafy vegetables can lower stroke risk because of their high content of nitrates. The body converts nitrates into nitric oxide, which can help relax the pressure in arteries, promote healthy blood flow, and reduce blood pressure. The cancer concerns you may have encountered about nitrates apply to processed meats, not vegetables. A meta-analysis found that vegetable-sourced nitrates were actually protective against gastric cancer, with a relative risk of 0.8. Processed meat nitrates increased risk, with a relative risk of 1.31. The difference lies in antioxidants like vitamin C that vegetables contain, which block the formation of harmful nitrosamines. Processed meats lack those protective compounds. Don't avoid vegetables because of nitrate fears. The nitrates in your salad are helping you. Conclusion. The evidence-based approach. Here's what the science actually tells us. Fresh vegetables remain powerfully protective against stroke. That meta-analysis covering 760,629 participants and showing 21% reduced stroke risk represents solid evidence. A 2006 Lancet meta-analysis of 257,551 individuals found that more than 5 servings per day of fruits and vegetables correlated with 26% reduced stroke risk. Dr. Kevin Barrett, a neurologist at Mayo Clinic Jacksonville, states it simply: a diet high in fruits and vegetables and low in cholesterol and saturated fat can reduce your stroke risk. The 2024 American Heart Association and American Stroke Association Primary Prevention Guidelines give Mediterranean-style diets rich in vegetables a Class 1 recommendation, the highest level possible. 3 specific pathways create documented risks for seniors. First, high-sodium preserved vegetables elevate stroke risk through blood pressure increases. Meta-analyses show 23% higher stroke rates with high salt intake. Choose fresh over pickled, and when you do eat preserved vegetables, rinse them and treat them as small condiments. Second, vitamin K-rich leafy greens can dangerously reduce anticoagulation effectiveness in warfarin patients. An INR below 1.5 quadruple stroke odds. The answer isn't avoidance, it's consistency. Eat your greens regularly. Keep portions similar week to week, and work with your doctor on medication adjustments. Third, high oxalate vegetables may increase cardiovascular risk in kidney disease patients or those with low calcium intake. Anyone in that category should limit spinach, Swiss chard, beets, and rhubarb while ensuring adequate calcium. All 3 of these share something in common. They involve specific preparations, specific drug interactions, or specific populations, not vegetable consumption in general. Dr. Cheryl D. Bushnell, who chaired the 2024 AHA Primary Stroke Prevention Guidelines Writing Group at Wake Forest University, put it this way: the most effective way to reduce the occurrence of a stroke and stroke-related death is to prevent the first stroke. For most of us, that means eating more vegetables, fresh vegetables, prepared simply in reasonable portions, with attention to how they interact with any medications we're taking. The vegetable isn't the enemy. How we prepare it, how we consume it, and whether we're paying attention to our individual circumstances, that's what determines the outcome. If this information proved valuable, share it with someone you care about. Understanding these risks and knowing how to manage them could make a real difference in someone's life. Stay healthy, and we'll see you in the next video. And chard. Subscribe for more evidence-based health information for adults over 60. New videos every week.